Right, let me take you back to our top story then about the international aid reaching India as it battles a crisis around the COVID-19 infections. We'll speak to Dr. Jugal Kishore, who is Secretary of the Delhi branch of the Indian Public Health Association. He's also a Vice President of the Indian Association of Epidemiologists. Welcome to DW. Now, we've heard of ventilators arriving from Britain and Saudi Arabia, sending 5,000 oxygen cylinders and vaccine raw materials on their way from the United States. How much difference is all this international assistance likely to make?
This kind of assistance is going to be beneficial because we are facing a lot of problem as far as the ventilator is concerned. Although in first wave we had problem and we have procured large number of ventilator and it was sent to different states. But what is now happening in second wave is large number of cases coming to hospital and we are not having the beds. So all ventilators are occupied. Now what is required is to make shift hospital in open area or in stadiums where we require beds and also ventilators. So such kind of ventilators and the beds are going to be very great help because we have huge number.
So did I understand you correctly when you said that you had India had the ventilators, but they were essentially in the wrong place?
No, it is not like that. In the first wave, we had shortage of the ventilator and it was procured from different countries and it was supplied to different states. In our country, we have a large number of states, more than 25 states are there. So they have been sent to different states. But now in second wave, the number of patients are huge and all hospitals are occupied and all ventilators are not enough. So we are making makeshift hospital in stadium and other open places. There we require beds and ventilators. So such kind of, the new supply from different countries is going to be beneficial.
And how did things get so bad?
Actually, India is second largest country in the world as far as the population is concerned. And even if you say, 17.6 million people have suffered from this COVID, and we have only just 0.2 million deaths. And when we calculate in terms of, then it is not even 1% of the cases are dying. But this number is such a huge and big that, for any small country, it can be a nightmare. So when it comes to number, then I think India is, top in the list. And very soon we are going to, actually we have already has the highest record of the everyday cases. 0.3 million, like in 3 or 4 days, we have 1 million cases. So because of this, we have exhausted all our resources.
So is it possible to bring this crisis back under control, or do you just have to wait until it takes its course?
According to our predictions, it is soon going to be under control because large number of patients, almost I think 70% or 75% of the total population is going to be suffering from, and they will be developing towards the herd immunity. So in some states like the Maharashtra and Delhi, we have reached to the highest peak, and now the number of cases start decreasing. So in some state where the wave was started early, we had, receding now. And in some state like the UP and Assam and Bihar, we are seeing some uprising. But at the national level, it is now, almost I think we are reaching to the highest peak.
All right. Thank you for joining us, Dr. Jugal Kishore from the Indian Association of Epidemiologists.
Thank you. Thank you.